Stiff person syndrome, about the disease, what it is, symptoms, and treatment. Part -2. Clinical history and actual assessment. An accurate evaluation of the patient's medical history combined with a thorough physical examination can provide a first indication of the occurrence of muscular rigidity and other associated side effects. Treatment options. While there is no cure for stiff person syndrome, various treatment options can help manage the symptoms and improve quality of life. Blood tests. Blood tests are used to measure levels of certain antibodies linked to immune system issues, such as hostile stray antibodies, which are occasionally elevated in SBS patients. Electromyography, EMG. EMG keeps the muscle's electrical activity active. EMG in SBS can reveal unique instances of muscle activity, adding credence to the claim. Electromyography, EMG. EMG involves recording electrical activity in the muscles. In SBS, EMG can reveal abnormal patterns of muscle activity, further supporting the diagnosis. Medications. Muscle stiffness and spasms can be treated with pharmaceuticals such as muscle relaxants, anti-anxiety medications, and anticonvulsants. Benzodiazepines including clonazepam, diazepam, and baclofen are frequently prescribed drugs to treat SBS. Physical therapy. Physical therapy plays a crucial role in the treatment of stiff person syndrome. Stretching exercises, range of motion activities, and gait training can help improve muscle flexibility, coordination, and overall mobility. Physical therapists can also guide adaptive devices that can assist with daily activities. Intravenous immunoglobulin, IVIG. In intravenous immunoglobulin, IVIG, therapy, antibodies obtained from healthy donors are infused. In some people with stiff person syndrome, IVIG has shown promise in reducing muscular stiffness and enhancing motor function. However, each person will react differently to IVIG. Plasmapheresis. During a plasmapheresis process, the liquid component of the blood, or plasma, is removed and replaced with donor plasma or a plasma substitute. The purpose of this therapy is to get rid of negative autoantibodies that could be causing SBS symptoms. Plasmapheresis is normally only used in the most severe situations or when all other therapeutic options have failed. Lifestyle modifications. Stiff person syndrome sufferers can improve their ability to control their condition by making certain lifestyle changes. Both the frequency and intensity of symptoms can be decreased by employing approaches for managing stress, engaging in regular exercise, and getting enough rest. Coping with stiff person syndrome. Both physically and emotionally, having stiff person syndrome can be difficult. People with SBS must get assistance from family, friends, and medical experts. The practice of self-care and participating in enjoyable activities can both improve general well-being. Support and resources. For people with stiff person syndrome and their carers, there are numerous support groups and organizations that offer information and a sense of community. These platforms give access to insightful information, emotional support, and a way to connect with others going through comparable difficulties. Latest research and future directions. Understanding the fundamental causes of stiff person syndrome and creating better therapies are the main goals of ongoing research. For those with SBS, improvements in immunotherapy, gene therapy, and neurology show promise for a better prognosis and quality of life. Conclusion. Muscle rigidity and fits are fascinating and intricate neurological symptoms of a solid individual ailment. Various therapeutic options are available to deal with the adverse effects and improve personal happiness even though there is no permanent solution. People with SBS urgently need early diagnosis, multidisciplinary care, support from medical experts, and positive social networks. FAQs. Can stiff person syndrome be cured? There is no known cure for stiff person syndrome at this time. Nevertheless, there are several therapy alternatives available to control the symptoms and enhance the quality of life. Is stiff person syndrome a genetic disorder? Stiff person syndrome is thought to have both hereditary and environmental causes, while the specific origin is unknown. Can stress worsen the symptoms of stiff person syndrome? Stress and emotional anguish can cause or exacerbate stiff person syndrome symptoms. Using relaxation methods and coping mechanisms to manage stress levels may help reduce symptoms. Are there any support groups for individuals with stiff person syndrome? Yes, there are organizations and support groups devoted to giving stiff person syndrome patients and their carers access to resources, knowledge, and emotional support. What are the long-term effects of stiff person syndrome? Mobility, muscle function, and general quality of life can all be significantly impacted over the long term by stiff person syndrome. However, people can improve and develop better coping skills with the right supervision and treatment.